Hello and welcome to Fertile Minds. Nice to see you all. My name is Manuela Toledo, the Medical Director of TasIVF. And today I thought I'd talk a little bit about IVF versus ICSI or ICSI. You may already be doing fertility treatment, and it may be that your fertility specialist has recommended IVF or ICSI, or maybe even a combination. Up to 60% of our patients require ICSI, and that's where we actually select an individual sperm to inject into each of the mature eggs that we obtain during the IVF procedure. And the reason for this might be that the sperm count is not very good. It might be that the sperm are not swimming fast enough. And it is very important that the sperm have good motility, because it means that the sperm can actually reach the egg and fertilise the egg. So if that's not happening naturally, or it's not happening during the IVF procedure, it may well be that we've recommended that you have ICSI or ICSI, also known as intracytoplasmic sperm injection, which is a bit of a mouthful, so we just say ICSI. During the ICSI process, the actual egg, which is like a speck to the naked eye, is actually magnified 100-fold under the microscope, and it's secured with a pipette so that it actually can't move. And then very gently the scientist will actually suck up a mobile sperm that looks good, and the scientists are very good at selecting which sperm is the best for each procedure. Once they've actually got that little sperm in the end of the pipette will be gently injected into your egg, and the sperm will be lodged into the centre of the egg to allow for fertilisation to happen. ICSI or ICSI is a very delicate procedure, and a lot of training is required, and all of our embryologists are highly trained in this mechanism, given that 60 to 70% of our patients require this procedure. In some cases, if we don't do ICSI, we will not get fertilisation of your egg. So it's a very important procedure, and it's been around since the early 90s. So there's been a lot of babies born from ICSI, and there's been quite a few longer term follow-up studies. So we do know that the ICSI generation, who were first conceived in the early 90s during IVF, are going to university at the same rate as their non-IVF, non-ICSI peers. And their development during childhood is normal as well. And it really has helped couples overcome male factor infertility and has contributed to millions of children conceived via IVF worldwide. So it might be that your fertility specialist recommends that you consider ICSI or ICSI over IVF. And one of the common reasons for this may be unexplained infertility and fertility failure with IVF alone. Another common reason is poor sperm quality, so where the sperm count is a little bit lower than average, and the motility, the velocity at which the sperm swim is a little bit reduced as well. Another indication for ICSI might be an increased number in abnormally shaped sperm. And that's something we're seeing quite commonly in the Western world in human males, and in fact in all male species, is that sperm quality is not as good as it was even 20 to 50 years ago. We're not quite sure why this is happening, but it would seem that global and environmental factors may well be playing a part. And so it's very important to have a really good diet and low alcohol and no smoking to really improve the quality of your sperm. Another time where you may need ICSI is if you've had unexplained IVF failure. And that can be really quite distressing, where the sperm look really good and the egg look really good, but when we try to get the two together, nothing much is happening. And when that happens in about 1 to 2% of cases during the IVF cycle, that might be a time to then consider a trial of ICSI to see if that will make a difference. As always, we're here to give you some ideas and recommendations, but ultimately we want you to discuss this with your fertility specialist. Thanks so much for listening again, and I'll see you very soon.